नमस्कार. लाईफ्स ऑन विथ मणिपाल हॉस्पिटल या कार्यावळीत परत एकदा तुमकां सगल्यांक येवकार. आज आमचे कडेन 2 दोतोर आसात आनी आमी अशा एका विशयाचेर आज जाणून घेतले ज्याचें बायलांक खूब म्हत्व आसा. कित्याक हें दुयेंस फक्त बायलांकूच जावंक शकता आनी म्हणून आमचे कडेन एक बायल दोतोर आसा, डॉक्टर सोफिया रॉड्रिग्स, आणि दुसरो दोतोर आसा तो डॉक्टर युजीन रेंट. वेलकम both of you in this episode of Lives on with Manipal Hospitals.
Thank you, sir.
Dr. Sophia, I would like to ask you first, what are we talking about today? What is that which is so important for a lady in life?
We are talking about a very important topic on cervical cancer. So cervix is that part of the uterus which is called actually पिशवीचे तोंड म्हणतात. पिशवीक वेरियस पार्ट्स असता. एक बॉडी 2 हात की फेलोपियन ट्यूब्स म्हणटा आणि दोन्ही सायडीन अंडाशयाची थैली असता, ओव्हरीज म्हणतात आमी. आणि पिशवीचे तोंड जे असता सर्विक्स म्हणतात. तो भाग पिशवीचो एक्सटिरियर.
What is it that we are talking about today which is so important to ladies?
We are talking about cervical cancer, which is one of the most commonest cancer. It is ranked as 4th in the world in women. Cervix is that part of the uterus which is facing the exterior of the body. It is exterior, it's exposing to the environment. आणि पिशवीक वेरियस पार्ट्स असता. एक पिशवीचे बॉडी म्हणतात, मागीर पिशवीचे तोंड जे सर्विक्स आज आमी डिस्कस जे करपाचे आसा. पिशवीक 2 हात जे हांव सिंपल टर्म्सान म्हणटा पण ताका फेलोपियन ट्यूब्स म्हणतात इंग्लिशीन. आणि दोन्ही सायडीन 2 ओव्हरीज असतात जे अंडाशयाचे थैली म्हणून आमी डिस्क्रायब करता कोंकणीन. सो सर्विक्स जे असता इज द मोस्ट एक्सपोज्ड पार्ट. बाकीचे सगळे पार्ट्स युट्रसाचे भितर बॉडींत असता. सो आमी फुडें वचून एक टॉपिकाचे आमी डिस्कस करता.
म्हणून सर्वायकल कॅन्सर चड डिस्कस करूं जाय. Dr. Eugene, how common is cervical cancer?
So if you're talking about cancer in women, if you see breast cancer and cervical cancer, they make up 50% of all the cancers seen in women. So basically, if you stop breast cancer and you stop cervical cancer, you're reducing the number of cancers in all the women to half.
Oh.
So it's a very, very common cancer. Not so common in Goa compared to other states, but overall, if you look at it, along with breast cancer, it makes up 50% of the cancers in women. So it's an extremely common cancer, and that's the reason why it needs to be tackled, and that's the reason why we are specifically talking about these cancers.
Any specific reason why it is not common in Goa?
Probably because Goan women are more educated, they're more into screening and things like that, which we'll be talking in some time. Because of that, these are cancers which are picked up early. So we want the screening to penetrate the entire population. We want the entire population to be screened, and that's the reason why we are talking about this cancer.
How it is caused? What are the common causes? What are the predisposing factors?
सर्वायकल कॅन्सराचो मोस्ट इम्पॉर्टंट कॉज एक HPV म्हणून व्हायरस असता, ह्युमन पॅपिलोमा व्हायरस, विच इज सेक्शुअली ट्रान्समिटेड. सो संबंध येता तेन्ना तो ट्रान्समिट जावपाक जाता. सो दॅट इज द मोस्ट कॉमन कॉज ऑफ सर्वायकल कॅन्सर, अँड सो इट इज मोस्ट कॉमनली सीन इन ऑलमोस्ट एवरी अदर केस इन सेक्शुअली ॲक्टिव्ह पीपल.
वो दादल्या कडल्यान वता?
It can come from both sides.
Oh.
So HPV virus can cause various cancers. Besides cervical cancer, it can also cause oral cancers.
Oh, I see.
So basically, when you're talking about cervical cancer, there are 2 things we look at. One is the inciting factor, and one is the progressing factor. That's how we talk about it medically to explain. One which initiates it and one which progresses it. So HPV is the inciting factor of all cervical cancers. But then there are the progressing factors. That is having multiple sexual partners or smoking, obesity. There are a lot of other factors which are progressing factors which help having multiple children. So these are all progressing factors. The inciting factor is basically HPV, but when you say sexually transmitted, does not mean that the person is having multiple partners.
Yeah.
Even with a single partner, with husband and wife, it can happen. So it does not mean if someone has cervical cancer that they've been promiscuous. That is a misconception that people should not have. It can happen to anyone. It can happen to one of our wives, our children. It can happen to anyone because they need just a single exposure for the bacteria, for the virus to go.
Single exposure. Huh?
Yeah, a single exposure is enough for the bacteria, for the virus to go and sit there. And then when they have all these other factors which keep on causing the promotion, that's what causes the disease to grow.
Oh,
so there are various strains of HPV. Some of them are innocent strains which usually cause, they will not cause cervical cancer. But the ones which actually cause cervical cancer are HPV 16 and 18. But खूप जाण HPV वायरसाक एक्सपोज जाता पण सगळ्यांक सर्वायकल कॅन्सर जायना कित्याक तांची इम्युनिटी बॉडीची बरी आसता एज डॉक्टर युजिनान सांगलां आमकां की सर्टन फॅक्टर्स आसा जे स्मोकिंग केले की आनी कितें जे इम्युनिटी तुजी कमी जाता बॉडीची तेन्ना मागीर तो HPV वायरस अटॅक करता आनी थंय रावता आनी सर्वायकल कॅन्सर इज वन ऑफ द स्लोवस्ट ग्रोईंग कॅन्सर्स सो दॅट इज द रिजन वी आर insisting on screening because it takes almost 5 to 10 years पयली एक्सपोज जावपाक आनी एक्चुअली फॉर्म जावपाक सो 5 ते 10 वर्सां आमच्या हातांत आसता स्क्रीनिंग प्रोसेस करपाक सो ते 5 वर्सांनी सुद्दां एकदां आयलो मनीस चॅकिंग करपाक ते आमकां स्क्रिनिंगांत केस
कळटा कशें बायलेक आपल्याक सर्वायकल कॅन्सर जाला म्हणून
खूब सिम्पटम्स आसता ओके तिका एखादा कळत ना शी मे नॉट रियलाइज इट बट देर आर वेरियस सिम्पटम्स लायक फाउल स्मेलिंग डिस्चार्ज और इरेग्युलर menses bleeding abnormalities or after intercourse there could be bleeding or there could be bleeding between menses so these are the common symptoms of cervical cancer but some of them may not realize that these are the symptoms of that and because of not knowing they may not approach to a doctor so these are the common symptoms.
Any influence of systemic diseases like say diabetes, hypertension on the
not
causes?
really. Not really.
Not really. You don't have to bother much about alcoholism.
No, you don't have to bother much. Smoking, like I said, is one of the factors which incites, but otherwise nothing much.
Now, see, like Dr. Sophia said, you take about 5 to 10 years for you to know that these are the symptoms. Correct? Now, after say 5 years, let's take a little smaller period. After say 5 years, you approach a doctor with these symptoms, and then you are diagnosed to have cervical cancer. How do you go ahead
with treatment?
Not how do you go with diagnosis?
So basically, what happens is once the patient comes, if they are suspected, so what we do is we do an examination, what we call a pelvic examination. So that is when a gynecologist or an oncologist like us, we examine the patient and it tells us, yes, there is a lesion over there. The next thing we do is we do a staging of the disease. That is to see what stage, because the thing is different stages have different treatment plans. So we stage the patient. That is, we do a proper examination of the patient and we remove a little bit of tissue. It's a painless procedure called a biopsy. It has absolutely no pain. We remove a little tissue to confirm the diagnosis. Now once we remove the tissue and send it for testing, in about 3 to 5 days, the patient will get the report. So then you know they have cancer. The next is staging the disease, like I said, which is a clinical evaluation, and some patients may require a further test, either an MRI or sometimes a test to see if the bladder or the rectum is involved. And with all these tests together, you will get a final stage of the patient. Based on the stage, the patient goes in for treatment.
Okay, we'll come to treatment part later. I want to ask Dr. Sophia, you were to parat screening karo jai mantale. What is that screening and when it should start?
What is the difference? Screening is basically done for healthy patients. It's not that symptoms usually cervical cancer जे symptoms असता ते usually stage 2 की 3 or 4 आन दिसतले आमकां ताजे पयली आमकां चड symptoms दिसचे ना सो म्हणून आमी स्क्रीनिंग इन्सिस्ट करतात कित्याक स्क्रीनिंगाक तुका एब्सोल्युटली नॉर्मल आसतले ताका सिम्पटम्सूय आसचे ना आनी कांय प्रॉब्लमूय आसचे ना and actually there might be a lesion which might be pre-malignant, pre-cancer, even cancer जावचे पयली आमकां कळटा through various tests. हो स्क्रीनिंग टेस्ट जे महत्वाचो आनी सगळ्यांक खबर आसपाक जाय तो म्हणटात पॅप स्मियर टेस्ट. Pap smear test is a screening test for cervical cancer which we advise for all sexually active girls. I no longer say married, it is sexually active girls once in 3 years. Okay, twice if it's normal, then we would say once in 5 years. But now even more frequently we would say, and not just stick to the 3 years protocol.
Oh, once in 3 years?
Yes, because it's a slow growing.
Yeah, and
if twice it's normal, then once in 5 years.
Oh, so first 6
If
years,
two
if you get
consecutive
two
times if it's
tests is
normal, then once in 5
then,
years.
and it is sexually active girls.
So it may be
Yeah.
as early as 18 years and even as early as 20 years.
Yeah.
The
yes.
beauty of screening for cervical cancer, see, there are different cancers in the body. There is stomach cancer, there is liver cancer, there is different cancer in the body. So basically, for a screening to work, number one, there should be a slow growing disease. That is, it should take a long time, because the disease comes in 2-3 months, then there's no point in screening, because you can't screen every 3 months. It should be a slow growing disease. Second thing is, there should be an easy test to diagnose the disease. In the case of cervical cancer, there's the pap smear, like Sophia said. And number 3, there should be a good treatment available for the disease. Cervical cancer, breast cancer, and colon cancer, and to some extent prostate cancer, these are the only 4 cancers in the body which have got a fantastic screening. I mean, they are totally susceptible and amenable to screening. So basically, like I said earlier, the 2 common cancers in women, breast and cervical cancer, both can be screened and both can be prevented. And the beauty of cervical cancer is, you diagnose it through screening in stage 0, not stage 1. It is before the disease has started, you diagnose it. That is, the cells are starting to change, but they're not yet changed.
Oh.
This is why we say screening, ideally from the age of 21, every 3 years, 3 consecutive screens, and then based on what your doctor tells you, you continue for the further screening.
हाजो अर्थ असो की लग्नाच्या पयलीं जाल्यार खंयच्याय दादल्या कडेन संबंध येत एंड यू आर सेक्शुअली एक्टीव जाल्यार स्क्रीनिंग टेस्ट फॉर सर्वायकल कॅन्सर इज ए मस्ट. तातूंत भिवपाचें ना, लजपाचें ना, लिपून दवरपाचें ना, कित्याक तो बायलांच्या आयुश्याचो प्रश्न. नंबर 1. नंबर 2, लग्न जातकीच तर सर्वायकल कॅन्सर स्क्रीनिंग करूंकूच जाय आनी दादल्यांनी सांगून करूं जाय. नाजाल्यार लग्न जालें आनी रोखडीच पॅप स्मियर करपाक गेली जाल्यार दादल्यांनी दुबाव घेवपाक जायना, कित्याक ताचें कारण दादल्याच कडेन आसता त्या व्हायरसाचें एकदां. सो दादल्यांनी सांगून पॅप स्मियर करूं जाय, ज्यो टेस्ट आसा त्यो करून घेवं जाय, 3-3 वर्सांनी त्यो रिपीट करूं जाय. हें अतिशय म्हत्वाचें. लजेक गेल्यार पेजेक पावना म्हणटा. त्यामुळे इट इज ए मस्ट for every family to know this very important point which both the doctors have insisted. Now, coming back, you have now detected the cancer and there are symptoms which the people have come. Dr. Eugene has told what are the stages. What is the prognosis? म्हणजे पेशंटाक खंयची स्टेज जायत जाल्यार ताका भंय ना.
ताजे पयलीं हांव मातशें पॅप स्मियराचे एक्सप्लेन करतलें सर, कित्याक लोक जेन्ना म्हजे ओपीडीन येता पॅप स्मियर म्हणून तांकां दिसता आमी कापतली कितें करतली आनी पयलींच ना म्हणटा टेस्टाक. सो मातशें एक स्मॉल डिस्टॅग ऑफ पॅप स्मियर. पॅप स्मियर एक डक बील कसो एक स्पेक्युलम आसता, इन्स्ट्रुमेंट आसता आमचे कडेन, जे आमी इन्सर्ट करतात लोकली वजायनल एरियान. कांय दुखना बीन कांय ना, मातशें डिस्कम्फर्ट आनी प्रेशर फिलींग येता. मागीर ते पिशवीच्या तोंडाक आमचे नाका सारकें आसता, एक ब्रश आसता, इयर कॉटन बड कसो, तसोच आमी फक्त लायतात ते पिशवीच्या तोंडाक. कट बीन कांय करिना, फक्त लायतात आनी मागीर सेल्स ते स्लायडीर घेतात आनी मागीर ही स्लायड अंडर मायक्रोस्कोप चॅकिंगाक वता. सेल्स कसले आसा, नॉर्मल आसा की कॅन्सराचे जावपाचे आसा की कॅन्सराचे आसा जाल्यार. सो खूब लोक पयलींच भिवून पॅप स्मियराक वयर एक्झामिनेशन टेबलार चडत ना आनी पयलींच नाकाच म्हणटात टेस्ट. तो भंय आसा की दुखतलें, पेन जातलें आनी पयलींच ना म्हणटात. सो इट इज अ व्हेरी सिंपल टेस्ट. तातूंत कांय दुखपाचें बीन कांय ना, डिस्कम्फर्ट मातसो आसता तितलेंच.
There is no bleeding.
There is no bleeding usually that happens. And also there are some prerequisites for the pap smears. 3 days before there should be no intercourse, there should be no bleeding and no local applications of creams, jellies or ointments. Otherwise your test can come faulty.
Oh.
Okay.
So pap smear is the first test.
Yes.
Everyone has to do.
Yes.
Now, like you said, ki दर 3 वर्सांनी स्क्रीनिंग टेस्ट करून जाय. Does it include pap smear?
3 वर्सांनीच सांगतात.
3 वर्सांनीच. 3 वर्सांनीच करून जाय.
3 वर्सांनी एकदां करपाक जाय. 3दा नॉर्मल आयले जाल्यार मागीर 5 वर्सांनी सुद्दां केल्यार नो प्रॉब्लेम.
करेक्ट. सो भिवपाचें ना, बिकॉज इट इज लिटल पेन. कोणाकूय दांत काडटाना सुद्दां दुखता, पूण चाबूंक येना, जेवपाक मेळना जाल्यार आमी दांत काडटात न्ही. तितलेंच म्हत्वाचें हें की इफ यू वॉन्ट फर्दर टू एन्जॉय युअर लायफ, देन प्लीज फॉलो दीस रुटीन and undergo this test which she has very nicely explained that it is almost painless with little discomfort. Yeah. Now we come to your grading.
So basically, once we stage the tumor, we then prognosticate, as in we tell the patient how long they're going to, what are the chances of cure. The good thing about cervical cancer is most of our patients come in stage 1 and stage 2.
Very good.
Yeah. So when you talk about stage 1 and stage 2, you're talking about a cure rate of way over 90%. Stage 1, you're looking at close to 100%. Stage 2, you're looking at a cure rate of over 90%. The ones who come in stage 4, when you say stage 4, it means that the disease has spread to the liver, it's spread to the lungs, it's spread everywhere. Stage 4 patients are not curable. Unfortunately, they're not curable. We just treat them to keep them comfortable, to reduce their symptoms and things like that. Stage 3 patients have got a decent survival, which is in between, depending on how aggressive the disease is. So, hopefully at the end of this talk, we're not going to see any more stage 3 and stage 4. So, everyone with cervical cancer is going to look at a 90% chance of cure, which means 9 out of 10 of our patients are cured. They're going back home without any disease and they're going to live the rest of their life, probably till some other cause like takes them eventually, but cervical cancer is not what's going to kill them.
Now, when you say any treatment in cancer, people have got fixed notions. It's chemotherapy and or radiotherapy.
Yeah.
Now, what is the treatment in these stages?
In the initial
cervical
stages,
cancer?
that is stage 1 and 2, usually it is with surgery, and third and fourth usually for radiation. Dr. Eugene can explain little more in detail on this.
So basically it's like this. So you have the uterus in the middle, like she has told you. It's attached by 2 rubber bands on either side, okay, what we call the parametrium. Now once the disease enters these rubber bands, and suppose you cut a rubber band, what happens? It flies to the side, correct? So that time the disease gets thrown aside. So if there's disease in the side rubber bands, that means that the disease needs radiation as a treatment. So in stage, once it touches stage 2 onwards, once it's spreading further than that, we treat the patient with radiation. If the disease is not in that, if it's just localized to the uterus and the cervix, then removing it is very easy.
I'm just disturbing you.
Yeah.
This you know where the disease is by
Just by putting the finger, we come to know.
You don't require
We sometimes
MRI
do an
and all.
MRI. We can do an MRI, but the current staging protocol does not include an MRI. But we do it. We do it just to confirm that things are this thing.
Yeah.
But generally, on international standards, they do not do an MRI. It's not really
But you
required.
can locate it.
You can locate it.
Very good. Now,
Just by a finger examination.
Yeah.
So, if the disease is confined to the uterus and the cervix, the treatment is surgery. If the disease spreads outside, the treatment is radiation. But this decision is taken by the doctor. It is not a decision taken by the patient. The patient shouldn't go to a hospital and tell the doctor, no, I want radiation or I want surgery. Faith in the doctor, trust in the doctor is what's going to eventually lead to your cure. So, the side effects of both are similar. The post-treatment course is similar. Everything is similar. It's only the duration which varies a little bit and the planning which varies a little bit. So, leave it to the doctor as to what is
whatever
better.
is the stage, surgery is a must.
No, surgery is only if the disease has not gone into the side bands.
Oh.
Once it goes into side bands, radiation is better than surgery. But if it's localized to the uterus, surgery is better than radiation.
No chemo.
Chemo is given along with the radiation to to help the radiation work better. But there's no standalone chemotherapy for cervical cancer.
Now, cervical cancer patient एकदम जो आयलो किंवा cervical cancer prove झालो, whatever is the stage. मागीर it can be uterus cancer, it can become ovarian cancer. कळ्ळें तुका न्ही? You are basically cervical cancer. Spread जाता तो खंय जाता तो I don't know. But then मागीर तो uterus cancer जाता, मागीर अशें कितें आसा?
No. It will if it's cervical cancer, it will be primarily cervical cancer unless there are coexistent cancers, but usually doesn't happen. But it spreads. It can spread from the cervix to the uterus, but the same cancer can spread, and it can spread to the surrounding areas also. So you can usually will not have a uterus cancer, ovarian cancer, everything together.
So they're basically very, very different cancers. Cervical cancer is very different from uterine cancer and from ovarian cancer. When I say different, I mean the treatment is completely different. Now, ovarian cancer is mainly chemotherapy and surgery. So the treatment protocols are very, very different. So patients should understand that cervix does not mean uterus, does not mean ovary. A lot of general public, they think that the person has cervical cancer and my neighbor also had cancer of this thing, so it is the same cancer. So do not go by the treatment that your neighbor had. They may have a completely different cancer. When we tell the patient, we tell them you have a cancer around the delivery area, so they get confused and mix these three. These three are completely different cancers with different treatment, different everything.
पिशवेचो कॅन्सर जाला अशें म्हणून आमी ओव्हरी, युटरस आनी सर्विक्स ह्या तिगांकूय मिळून खुबश्या वेळा पिशवेचो कॅन्सर जाला म्हणटा. सो पिशवेचो कॅन्सर म्हणजे खंयी जावं येता अशें न्ही. पिशवी म्हणजे युटरस, युटरसाचें तोंड म्हणजे सर्विक्स, सांगलां तशें. सो दोतोरान सांगलें तशें शेजारच्या बायलेक पिशवेचो कॅन्सर जाल्लो म्हणून तिका किमोथेरपी दिल्ली. म्हाकाय आतां पिशवेचो कॅन्सर जाला म्हणून सांगलां म्हणून म्हाका दिना अशें म्हणून खुबशे लोक ह्या दोतोरा कडल्यान त्या दोतोरा कडेन, त्या दोतोरा कडल्यान त्या दोतोरा कडेन अशें वतात. अशें न्ही. दोतोर ठरयता कॅन्सर खंय जाला तो आनी प्रत्येक कडल्या कॅन्सरा खातीर वेगळी ट्रिटमेंट आसता. नाव in this line of treatment or the investigations that are done, are they too expensive for a common man?
They are not very expensive because they are basic if it depends upon the stage of this. So if it's for surgery, then we do the routine pre-op investigations. So that includes the ultrasound or an MRI and the blood and the urine workup.
How?
So let me put it in a different way. So you're looking at cost of two things. You're looking at cost of investigation and cost of treatment. Now cost of investigation, you're looking at a cost, say maximum it comes to about 10 to 12,000 rupees, including the pre-op workup. If a scan is needed, if everything is needed, a maximum of 10 to 12,000.
That's all.
Yeah. Then you're looking at the cost of treatment. Now the beauty of cost of treatment for patients in Goa is you have the Deen Dayal scheme.
Yeah.
And the Deen Dayal treatment, for example, in Manipal hospital, I treat every one of my Deen Dayal patients absolutely free. The surgery is free of cost, the radiation is free of cost. If they need chemo, the chemo is free of cost. So no patient should ever avoid treatment saying that the treatment is too expensive, because I will guarantee the patient that the treatment will be done free of cost in Manipal hospital under the Deen Dayal scheme.
Now, see, you are a oncologist now.
Yeah.
Correct. Most of the patients they have their own obstetrics and gynecologist.
Yeah.
Right from prenatal stage to up to delivery. In case of a problem, what is the time that a patient should go to an oncologist? The first symptoms of foul smelling discharge, bleeding, or anything else, or it is a referral thing?
So patients come to us both ways. There are some patients who come directly to us because they see they have these symptoms, they read about it on the internet or they read about it here and there and they come to us. A lot of patients come through gynecologists because most of the gynecologists in Goa are in touch with us. Either me or there's another surgical oncologist in South Goa. They're in touch with all of us. So the minute they notice that a patient's having a problem, many gynecologists do treat cancers themselves, then they do a good job. There are some who feel that they do not want to treat it themselves, they want to send it to someone else, and they're always in touch with us. So they do come through referral to us, and we take care of the patient and we coordinate with the gynecologist as required. Because the patient, remember, cancer treatment is not a 1 day or a 2 day thing, it's a long process. The patient needs not only physical, they need emotional support, they need post-op hormone treatment, they need a lot of things, support. So treating cancer is a team affair. It's not by one doctor, it's by a team of guys.
पेशंटाक सर्वायकल कॅन्सर जालो न्ही, दर स्टेज 1 डिटेक्ट जालो सर, इज देर एनी रिस्ट्रिक्शन फॉर चायल्ड बेरिंग?
स्टेज 1 आमी युजली सर्जरी बीन करता तेन्ना युट्रस काडटात, मागीर तो प्रश्नच ना की भुरग्याक लागून.
ओके ओके. सो सर्वायकल
unless it is a pre-malignant thing where it is even before stage 1, where we only remove a part of the, we call it a cone biopsy or a lids procedure, where cautery म्हणून एक electrical instrument असता जे फक्त तो part affected असता आणि disease margin, so part of the normal tissue should be there, there should be a disease free margin. So in such case we can conserve the uterus, because most often cervical cancer is seen in young people. So if it is before stage 1, that is pre-malignant stage, yes, we can save the uterus by just taking that part of the pre-malignant area and leaving back the normal cervix. So in such cases, they can still have children where they have not been exposed to chemotherapy or radiation.
They can.
Yeah.
Good. Now, one question I have in mind. See, cancers are also related to age.
Yeah.
Correct. Some cancers happen in old age. Now, cervical cancer, we have to start testing at the age of 21.
Yeah.
Correct. To say yes or no. Till what age should you continue doing pap smear?
So cervical cancer is a cancer of the younger women, like Sophia has mentioned over and over again. So that's the reason why we start screening at very early age. And just to add to your previous question, the beauty of screening is you can detect in stage 0, which I mentioned earlier, which means we do the leap procedure, what she spoke about, and we save the uterus. So that's the benefit of screening. Benefit number 2 is if it progresses, it's in stage 1, the chance of cure is 100%. We continue screening till an age when the person feels that they will undergo treatment. So generally we stop screening at about 65 to 70.
65. It's 65.
So 65
Till
to 70.
65 they have
65
to do
years.
pap
Yes,
smear. Huh?
yes.
Till 65.
Yes.
Till an age when the person thinks that they're going to take treatment. Now if the person's reached an age where they say even if it comes positive, I'm not going to undergo surgery,
Correct,
I'm not
correct,
going, I'm
correct.
too old for anything. That's the age when we say, okay, now you can stop your screening.
Otherwise,
It's very unlikely that cervical cancer will happen after 65 years.
yeah.
Because it's seen, the HPV that they must have got exposed to is 10 years before. So it's 8 to 10 years later, which is average, say from 30s to around 45, 50 years. That's the time when we see most of the cervical cancers.
Does diet play any role?
Not really.
Not really.
Not really. In some other cancers, yes. In cervical cancer, no.
Does hygiene play any role?
In improving the immunity, yes, but not really again.
Not.
No, not really.
So, because it is a virus.
Yes.
Now, are there any vaccines for this?
So the vaccines, it is the only preventable cancer. One of the preventable cancer is through the screening methods which we have explained, and second is the vaccines which are available now for preventing cervical cancer. The names of those are injection Gardasil and injection Cervarix. They can be given as early as 10 years, from 10 years of age to around 35 years of age. Earlier the better. So if the vaccine is given before the exposure of sexual activity, that is before exposing to the HPV virus, it is much better effective because this vaccine, the content of the vaccine prevents the HPV virus from attaching to the cervix.
Oh.
Okay, so it is now also put in the Indian immunization schedule. All over the world they are following right from 10 years, but somehow there is a hesitation in India to give their children the vaccines. One, because they are not made mandatory and they are expensive. So each dose is around 1,800 to 2,000 rupees.
And how often it should be
The
taken?
frequency is 0 months, 2 months and 6 months.
Oh, that's all.
I have myself taken it, so and hardly any side effects. I would say a little bit of giddiness that I faced, but not much. No fevers, no nothing.
So only 3 doses?
Yes,
That's all.
it's a lifelong
Yeah, that's
immunity.
it.
Yeah.
So taka prevention asa 0 months, 2 months and 6 months after birth. Correct?
From 10 years of
From
age.
10 years.
From 10
From
years of
10
age
years,
to
so
35 years of age.
0 months, 2 months, 6 months. So ह्या आणि ही वॅक्सीन जाल्यार घेत जाल्यार सर्वायकल कॅन्सर कॅन बी प्रिवेंटेड. ह्या सगळ्यांनी लक्षांत दवरूंक जाय. हें आमकां खबर नासता आनी ताका लागून आमी प्रिवेंट करूंक शकना. पूण हो असो एक कॅन्सर दोतोरान सांगला तशें की जो आमी प्रिवेंट करूंक शकता. बेगीन स्क्रिनींग करून डिटेक्ट केलो जाल्यार तो ऑलमोस्ट 95% क्युरेबल आसा. हाजेर आमी सगळ्यांनी लक्ष दिवंक जाय. थँक यू बोथ ऑफ यू फॉर गिविंग व्हेरी व्हेरी इम्पॉर्टंट इन्फॉर्मेशन एंड नॉलेज to all the audience about
Thank you so
cervical
much.
cancer. Thank you so
Thank
much.
you, sir.
Thank you, sir.